Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everybody. Happy Friday. It is the Friday before the holiday, and we are having a great conversation today with a friend of mine that I've known for many years on topics that I think are situations that many folks, many families are dealing with at the holiday season, as well as the rest of the year. So it's really important that we reach as many people as possible as soon as possible. So I want you to hit the like button, the share button, all those social media bells and whistles that tell people, hey, check this out. This is important information that you or someone you know needs to know about. Now, as you all know, I am Deb Burton, the host of Friday Friends and executive director of RI Elder Info, nonprofit here in Rhode Island, helping older adults, caregivers, and professionals get the information that they need in order to remain independent for as long as possible. And isn't that what we all want, is to remain independent? Absolutely. Now, as a nonprofit, we could not do this without the support of our sponsors. So huge thank you to Point 32 Health Foundation, to United Health, to Neighborhood Health, Oak Street Health, England Studio, 321 Media, and all of our individual donors and sponsors. We really could not bring this show to you without their support. So big shout out. Thank you very much. So this week I'm speaking to my friend John Tassoni. Welcome, John. President and CEO of the Substance Use and Mental Health Leadership Council right over in Warwick. How are you today, John?
Good, Deb. Thank you so much for having me on today.
I appreciate you taking the time to come on. It's the holiday season, and I was just reading some data that the National Institute on Alcohol Abuse and Alcoholism shows 17% of adults over 60 struggle with substance abuse. What does the Substance Use and Mental Health Leadership Council do, and how can we support our older adults and their families?
Well, we are a trade organization. We represent 42 agencies in the state. 28 of them are providers that do substance use and mental health for adults, adolescents, and people who are struggling. It's really bad out there. It's unfortunate with these fentanyl that's coming into the state and the country, along with xylazine and other stuff that people want to put into their bodies. It's a crazy time right now. It's hard for me to get someone a bed. The beds are like sold out. It's hard for me to get people into treatment as outpatient treatment because the workforce is so low. And we have no adolescent care in Rhode Island. A lot of the kids who are struggling with addiction issues, whether it be alcohol or substances, have to be put outside the state because we don't have anything anymore.
Wow, I didn't even realize, with being so focused on older adults, that there is no treatment for our younger people. That's heartbreaking and awful.
Yeah, we used to have an organization that had inpatient at Wallam Lake, but because of the rates, they were losing too much money, and they decided to close. And then another company came in and bought the organization, but declined to do adolescent work. So Rhode Island spends over $10 million a year shipping these kids out of state from Massachusetts, Connecticut, Vermont, New Hampshire, and Maine. And a lot of the kids are from inner cities that are struggling, and there's no travel stuff with the families. There's no family intervention anymore. So they go to have treatment, they come back, and they come to the same environment, and it doesn't work. It's not working. The recovery high school that I did when I was in the Senate in 2012 has just closed. So the high school is done. We're trying to get it re-upped again and started again, but this is like a perfect storm, Deb. Whether it be adolescents, whether it be younger than adolescents, whether it's older adults.
And do you find that it is actually worse than it was before COVID, or do you think COVID made it worse, or are we just more aware of our mental health?
As far as the mental health goes, I think COVID exacerbated the problem, isolation, non-communication of individuals. But as far as fentanyl and everything else, I think that has been increased due to COVID, only because people are more depressed. They want to take a step back. Then they're not making the money that they used to make. They've lost jobs. The families have split up. Again, I use this phrase: "It's a perfect storm."
Yeah. I was speaking with someone recently, and they said the second highest population for non-accidental opioid overdose, is our older adults. Do you have any insight on why that might be?
I have a little bit of insight on why it's, and I'll use this analogy. I'm 65 years old. I go in and I have shoulder surgery. I go home. I'm trying to recoup, but I only have 12 pain pills because the doctors are not prescribing like they used to prescribe. The pain is so dramatic. I call my doctor. The doctor says, "Hey, John, this is all I can give you under the DEA rules. Yeah, I can't give you any more pain meds." So what do? Especially in these older complexes, they start to go to the street.
Oh,
And
okay.
they're getting stuff that's looks like Oxycontin, but it's full of fentanyl. And what we're seeing, though, and the state still hasn't wrapped their hands around this, is that at 5 o'clock normally, a lot of the older folks like to have their dinners, have a glass of wine, they take the medication, they overdose. Now, you're under doctor's care because of your shoulder surgery.
Yep.
So they don't do an autopsy. So you're not even on the figure of having an accidental overdose. They may say, well, he probably died of a heart attack. But they don't know that you took a pill from somebody, one of your neighbors who's selling it, that's full of fentanyl, and you die. That's what we're seeing. That's what
Wow.
we're seeing, a lot of it now. And I just had someone on my TV show the other day talking about why this is happening. The pendulum has swung so far to the left for doctors. In the Midwest, doctors are being put in jail for prescribing opioids.
Oh my.
It's not the opioids that are killing people now. It's the stuff that's being put into the opioids from out of the country, or people making their own pill machines and doing their own thing. That's what's killing people right now.
So
And
the thought of limiting what the doctor can order
Mhm.
to avoid addiction is actually something that has driven people to get street drugs loaded with fentanyl.
Correct.
How do
Barbaric.
we solve that?
Well, I think the pendulum has to come back to the middle. I think DEA has got to say, all right, listen. There's bad politicians, there's bad doctors, there's bad maintenance men, there's bad everything. You can't do everything just because of the profession. That pendulum needs to come back to the middle. Doctors need to prescribe pain medication for pain patients, i.e., cancer patients, anyone that has a debilitating disease, anyone that has surgery. No one should live with pain. No one. But, we had all that influx of opioids come in, and it's not the opioids that are killing the people or making people addicted. It's the other stuff that they're putting in it.
Wow. I learned that with medication like Oxycontin, even when taken appropriately.
Mm-hmm.
We often think of, and the pharmacy, in fact, makes available Narcan
Correct.
because it can be so addictive. But I've also learned that when individuals are stopping taking opioids, are no longer taking the oxy, maybe their pain is resolved, that one of the little known potential side effects, it's not guaranteed, but it is a potential side effect, and it's listed pretty far down the paper, is suicidal ideation as a side effect.
Mm-hmm.
And I'm hearing that our older adults are our second highest population also for suicide.
Mm-hmm.
And with the holidays here, there's a lot of pressure, I think, that a lot of individuals feel to have that uh, Norman Rockwell perfect family image. And not everybody has that. Are there resources so that if someone is struggling, whether that be with addictions and substance use disorders or their own mental health, are there resources available out there for people to access? I know there's a workforce shortage,
Yeah.
but is help available?
Yes, there is. There's a suicide prevention on the Department of Health's website. Um, Panichis, I can't think of her first name right now. She runs the suicide hotline.
Is that the 988 number that
Yes,
anyone can dial?
correct.
Okay.
And you know, you hit the nail right on the head with the holidays coming up. People might not have enough money to do what they did previously. You know, we've just had a huge increase in electric bills.
Oh my goodness, yes.
The food is going through the roof. Everything is spiking. Gasoline, everything. It's
Housing, rent.
again. I'll use this phrase: perfect storm. You know, and people get depressed over it because they can't do for their family what they did for their family last year, and you know the grandchildren, the whole bit, and it's frustrating. It's frustrating when you're sitting in my seat, and I say this all the time on my TV show. I'm tired of going to wakes and funerals of young folks and older folks. I mean, this overdose epidemic that we have now, and I'll tell you just from Smithfield, because I sit on the town council in Smithfield, we've had 16-year-olds, we've had 25-year-olds, and we just had an 84-year-old. So what does that tell you? There's no boundary for fentanyl. There's no boundary for pain. And it might not be physical pain. It could be mental pain. And people just can't deal with it.
Absolutely. Absolutely. And are we seeing still the same level of alcohol use, or has that increased, or have people changed over to more opioids versus alcohol?
Well, I will tell you from the Department of Business Regulations, when I called and asked that question, alcohol sales in Rhode Island since COVID are up 300%.
Oof. Wow.
300%. And in my residential treatment facilities right now will tell me when I call, I ask the question, opioid, alcohol, where are you? It's about 50-50 now.
Wow.
If not, alcohol has risen above the opioid epidemic. And the reason why the liquor store stayed open, because you can die from a detox of alcohol.
I don't think people realize that.
Right.
So can you say that again?
You can die from a detox of alcohol. You cannot die from a detox from opioids. And that's why the liquor store stayed open. And people, you know, I've been in a lot of conversations with people who say, well, the governor, she should have shut down the liquor stores. No, they did it for a reason. They did it for a reason. Even though sales are up 300%, and a lot of people got hooked on alcohol because of the pandemic, but there's also a reason why they didn't shut it down.
And I think sometimes alcohol has long been the family secret. You don't talk about it.
No
and
doubt.
It has been something that has been socially acceptable for our older adults, sometimes for decades. And when mom or dad or your older loved one has that glass of wine every night at dinner, and then maybe completely unrelated to alcohol consumption, they have a fall, and now they're in the emergency room for 8, 10, 12, 14 hours, and they can't get that glass of wine that they would have had with dinner, they could be in crisis. And it's important then to talk about it. But I feel
Mhm.
like there's still a stigma around using alcohol that people don't want to talk about it.
Right. And the other thing is too, people should put their alcohol in a safe place. We've
Mm.
had calls here, sixth graders with alcohol
Oh,
poisoning.
oh my
Sixth
God.
graders. Now just think of that. My grandson is 9. Another year he'll be 10, be a sixth grader. It's not good. It's not good. Put your alcohol, lock it away so the kids can't get it. That, in fact, when people are using alcohol, older adults, please do not take your medication and then have a glass of wine. Take your medication, maybe an hour later, have a glass of wine, or try not to have a glass of wine. But if you have to, if you want it to calm or you need it to go to sleep, then do it after. You don't take it with it because ultimately you could have a big problem.
Oh my goodness, yes. Yes. And it's a myth that alcohol helps you sleep. It actually does not help you
No,
sleep.
no.
Um, that's a complete myth. So if someone were an older adult and they wanted to get treatment and they needed help, are there places that they can go as an older adult to get treatment?
Yeah, you can call the 988 number,
Hmm.
and they'll give you a list, or you can go on our website at SUMHLC.org. We have a list of all our providers. Matter of fact, we're doing a brand new website, hopefully starting in January, mid-January, and we're going to have who can take what insurances, how many beds are available. We're doing a multitude of different things on our website now because the crisis is so bad.
I'm really excited to hear that that information is going to be readily available, because that, I think, is one of the barriers to getting the care that people need.
Mhm.
Um, if people are really working on their recovery in at home, or in the community, are there resources that they can access? Can you share about your TV and radio show?
Well, I no longer have the radio. I'm just doing
TV.
TV now because I'm very busy. And I'm on the town council in Smithfield. I have a full-time job. I have 3 full-time jobs. I would suggest that you can go to your local folks. A lot of the cities and towns now, because of the crisis that everyone's in, has different information on their website. I suggest that you look at their website, the town websites, look for information. There's a number of locations throughout the state. If people want to help, some people take the help and some people don't because of the issue of privacy and the issue of needing someone with a license.
And is it true that the police stations, your community police stations, have drop boxes
Correct.
to take back medication? So if there's meds in the
Right.
house, maybe you have, family, friends, children coming over for the holidays, it might be a good time to clean out your medicine cabinet and just take those unused meds right to the drop box. It looks like
Right.
a mailbox,
Right.
everyone
Correct.
that I've been to.
But I will tell you, Deb, too. If you're having young kids over for the holiday, put your medicine away. Lock it up. Lock it up. A lot of the prevention folks in different communities have bags that you can put a lock on. And also, if you're selling your home,
Oh,
do not leave your medication in drawers, in the medicine cabinet. Take it away, put it away. We're seeing a lot of
wow.
folks who are addicted go to these open houses and going in people's medicine cabinets and taking what's ever there.
Wow.
Yeah.
Wow. A lot of creativity comes when someone has a substance use disorder.
Hmm.
Things
And
that
that,
we might not ordinarily think of.
yeah, and that's one of the big problems too about families breaking up It's the individual who is hooked on it, who's stealing, and who's selling. And then when they get better, the parents or whatever don't want to let them back in the house because of their prior issues. And I will tell you something else, Deb, which is a unbelievable statistic. We have over 12,000 children in Rhode Island right now living with their grandparents.
Yes.
Because we have parents who've passed away, we have parents who have been incarcerated, and we have parents that just packed up and left.
Yep. And those
and
12,000 grand families, those younger individuals are more likely to have mental health and substance use issues themselves, which is completely understandable, because if you're a little one and you've gone through whatever trauma has caused you to need to live with your grandparents, you need some help. You need that kind of support. So yeah, that there's a lot of children out there with those needs.
And here's another terrible statistic. It's going to be 8 to 12 months before you can get that young child an appointment with a psychiatrist or help for mental health and substance use issues. 8 to 12 months. That's unconscionable. I mean, I was hearing a story the other day from someone at Hasbro, 8 hours in Hasbro with a 6-year-old. How do you control a 6-year-old for 8 hours at Hasbro with all the other stuff that's going on within the hospital setting? It's tough. It's tough. The healthcare system is in tremendous quagmire right now. I'll use that word. I mean, I know I can't say what I want to say, but it's a mess. It's really a mess.
Yeah.
You know,
there are places like BH Link that can help for our older adults, because I have heard of older adults presenting at the emergency departments with mental health and substance use disorder crisis, and being in the emergency rooms 48, 72 hours before they're even considered for admission. So I know that BH Link over in East Providence is another option. Folks in crisis for suicide or substance use disorders can dial 988 from any phone anywhere. I believe you can also text 988. But there's ChildLink at Hasbro.
Yep.
I mean,
actually, BH Link is they're trying to go 24 hours to take some pressure off of the emergency rooms. I just got that email this morning.
That's wonderful news. It's sad that it's needed, but that's wonderful news.
But you know what, Deb, too? I mean, we just can't have one place in East Providence. I mean, especially now with the bridge going out. We need to have different locations. We need to have 4 of those BH Links in the community. If we're going to take pressure off the hospitals and the emergency rooms, I mean, even in the walk-in clinics, I've been told are packed. We need to have 4. We not need to have 1. We need to have 4.
Right. There are also Providence safe stations at the fire station. If you're having a substance use disorder crisis, they can help get you connected. Newport Mental Health has a mobile treatment team that comes up the East Bay, so they can help people in crisis. They can go to them. Thrive Behavioral Health also has a mobile treatment team. So I don't want people to feel like help isn't available. It might take a little bit of doing and a little bit of patience, but there is help and hope available out there. John, how can people support what work you're doing at the Substance Use and Mental Health Leadership Council? Because you compile a tremendous amount of resources on your website, updating your website to include the treatment resources and the insurance that they have. You have a list of resources for recovery housing and resources for people who are overcoming a multitude of different addictions. How can people support the work that is being done?
Well, I think that it could be twofold. I think one is to talk to your legislators, because we're going to have legislation this year, 2024, for substance use and mental health. And I think, I mean, I don't like to ask for donations. I mean, you can certainly donate. We're a 501c3 nonprofit. again, my TV show has been getting enormous amount of people watching it. I had AG Nerone around talking about the settlement last week, and we had 7,800 people watching on Sunday morning. So, I mean, the more people talk about it, the more people are in tune to what's happening. And if you see something, say something. I say that tongue in cheek, but there's a lot of stuff that's going on now. A lot of stuff. And if you think it's worth a phone call your local authorities. Well, if you're in an elderly complex and you see the same car coming the same time every week and the same people getting out of the car, I'm pretty sure something's going on.
And even if it's something that it's your friend or your family member, and you notice that they're not talking about the future, or they're giving their things away, I think sometimes we're afraid to ask, are you thinking of taking your own life? Because we're afraid that the answer may be yes. But not asking the question doesn't stop them from having those thoughts. Not asking is communicating that they can't talk about it.
I just remembered, I'm getting old too, Deb, so I just remembered it's the Samaritans. Denise Benitez that runs the Samaritans. Their number, you can give them a call, someone to talk to on the other line. If you're feeling depressed or you feel like, there's no light at the end of the tunnel, give them a call. Give them a call. Doesn't hurt to talk. Does not hurt to talk. And
Absolutely.
it's free.
Yes. Yes.
Free.
John, with all the work you're doing, I asked you for 15 minutes and I have roped you into almost 30. So I'm super glad that you were able to take this extra time, because I think the things that we talk about today are so important for so many individuals across the age spectrum, older adults to the little kids, to the grandkids, to everyone in between, because these are issues that is touching everyone's life.
Everybody. Yeah. Just a quick, when I started in this field, it was 1 in 5 families. Now we're down to 1 in 1. That is very scary.
Absolutely.
Very scary. Both mental health and substance use.
Absolutely. Well, thank you so much for taking the time to come on today, John. I really appreciate it.
Anytime, and I'll be sending you an email to come on my TV show too.
Absolutely. I look forward to it. Thank you. Great. I hope your holidays are peaceful. Everybody.
Yep. Yours too. Talk soon.
Yes.
Thank you so much.
So John and I have been friends for quite some time, and I cannot express enough to everyone watching that you are thought about, you are cared about, and I know that we're going into the holiday weekend, and there is that Norman Rockwell idea of what families and the holiday should be, and I know that that picture does not fit for everyone's family. So if you're out there and you're struggling, please dial 988, go to BH Link, go to a Providence Safe Station, get help, because we care about you. We want to see you again next week. We want to see you again next year. We want you to know that we care about you. Give me a call if you need to. I'm always available. I want to see you next week. Next week, we are doing our year-end review, and that is always fun. So I look forward to seeing you all again next Friday. And in the meantime, be well and be kind.
If you like this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.